Can you explain what sleep apnea is, especially in the context of children, and why it's crucial for parents to be aware of it?
Okay, wow. So that's a lot. Sleep apnea is essentially when your child stops breathing at nighttime. And we think sometimes that's just pauses, but there are different types of sleep apnea, which we don't have time to discuss. But one of the questions patients will probably ask me, like, what are the symptoms to kind of look out for? And you might want to look out, let's talk about a broader scope instead of sleep apnea, because some people get scared of that. Let's just talk about sleep disordered breathing, which could be early signs of sleep apnea. So you want to look for symptoms like loud snoring, restless sleep, frequently wakening up middle of the night, daytime sleepiness. Bed wetting is a big one. A lot of parents don't know that that's related to sleep disordered breathing, and sleepwalking and sleep talking as well.
It's really interesting that you mentioned about the bedwetting. I never would have thought those two would be related. And I just interject a little bit of a personal story because my daughter had sleep apnea and was diagnosed at 5. And she had incredibly loud snoring. We would joke that she could raise the roof off the house. It never occurred to us that somebody this young could have sleep apnea. So parents, I don't think would even make that connection a lot of the time. They might just think, I got a snorer in the house.
And it's cute, right, when they're little. But, the symptom that starts even before that, because I see babies in my clinic as well, so I see from 0 to 100, is mouth breathing. So I always say, like, sleep apnea is the fire. It's harder to put out a fire than a smoke. So the smoke signals usually start with something mild as mouth breathing and then all the other symptoms that I had listed.
So let's talk then about how this impacts their lives. How does it impact their learning and their behaviors?
Right. So, I mean, now think about it. If you have sleep apnea or any type of sleep disorder breathing, your quality of sleep is very poor for the child, right? Because somebody, like, personal story for me is somebody, like, when I got into this journey, my mentor asked me, like, Mandy, how does your son sleep? I'm like, there were two under two at that time. I'm like, I shut the door. I step away. I wake up in the morning and they wake up in the morning and we're all good to go. Like, he wasn't a troublemaker or nothing. But when he's like, Mandy, how does he actually sleep? Have you watched him? I'm like, when you have another one at home, it's not a judgment. It's just we're only human. So when I did watch him periodically, is that's when I noticed some of the symptoms. But what I realized with my oldest son, what he had was he had daytime sleepiness. So then that affects your concentration in school. That's going to affect how a child's ability to learn. And it actually affects cognitive development as well.
So I think people might be listening to this then and thinking, what does this have to do with visiting the dentist? So what does it have to do with visiting the dentist, and how can you help?
Well, so the way it's related is, remember, dentists, like, we're supposed to look at head and neck. So in my clinic, I screen, like I told you guys last time, I screen everybody for sleep. And one of the biggest issues that come up as soon as somebody says my child's been diagnosed with ADHD or they're suspecting behavioral issues, I know I got to do a deep dive into their sleep study. And guess what I usually find? I find these kids are either grinding their teeth, they have smaller jaws, like, the chin that's like tucked back, so protruded jaw, smaller jaws, and crowded teeth. So these are common symptoms I'll find in kids that have sleep disordered breathing, and that affects your airway, right? So the airway is what collapses when we have sleep apnea. Your tongue flops into it. So I look at all those things. I look at structure, function, and those two things combined are going to affect your sleep if they're not properly function or they're not where they're supposed to be.
So aside from surgery then, which is what my daughter had to have her tonsils and adenoids removed, what actions can you take in your office to mitigate this?
Thank you so much for asking me that. So, how I help children and adults actually for sleep issues is I do what's called early intervention, or I do orthodontics. So, what I'm doing for patients is I'm expanding them laterally, side to side, and I'm also expanding them forward. Forward growth. Forward growth is imperative because if you have a chin that's further back, like, those small little chins that we see, if I'm growing the upper jaw forward, the lower jaw will follow. And when the lower jaw follows, what we've done is we've essentially opened up the airway. So if you think about the airway where it sits on the back of the throat. And the lower jaw, if it's too far back, it impinges it. Just picture somebody doing CPR. right? What do? You do chill, you do head tilt, chin up to open up the airway for somebody. But I'm doing that orthodontically for that child or that adult.
All right, this is incredible. I am sure that a lot of parents listening to this right now are going to be tiptoeing into their kids' rooms tonight to see how they're breathing and if they're continuously breathing. This is really important. So people need to pay attention to this one. Kids do get sleep apnea. So Mandeep, thank you so much for joining me, and we'll have you back again next month.
Thank you so much.